Okay, guys, thank you for joining. Um, I'm Johnny, and today my project is on sensory processing disorder. Um, yeah, let's do it. Um, so, just a quick disclaimer, guys. The mental health information in this web provided in this webinar is strictly for general information and educational purposes only, and is not in any way a substitute for professional advice. Accordingly, before taking any actions based upon such information, we do encourage you to consult with the appropriate professionals. Um, we um, oh, sorry, we do not provide any individualized mental health advice during this time. This webinar may contain testimonials. These testimonials reflect the real-life experiences and opinions of such users. The testimonials are not intended, nor should they be construed as claims that our webinar can be used to diagnose, treat, mitigate, cure, prevent, or otherwise be used for any disease or medical condition. A warning: obscene gestures, words, or phrases may be involuntarily used during this session, known as tics. We encourage you to appropriately and respectfully react to such action. Involuntary actions may include behaviors that are unacceptable, repugnant, or inconsistent, in which contradicts one's true beliefs, reenacting one's movements or sounds, fidgeting, seizures, paralysis, impulsiveness, respiratory failure, eliminations, jumping, falling, etc. Another quick introduction here, just quickly. Before talking about sensory processing disorder, I think it's useful to think about actually what sensory processing is. We are all sensory beings, each with sensory preference and differences. It is only when our sensory preferences or differences interfere with our ability to do everyday tasks that it then becomes a problem. Sensory processing is the ability to register, interpret, and organize sensory information coming into the brain in an effective way that allows you to be efficient and have organized responses within your environment, e.g. being able to walk through a busy shopping center and focus on what you need to buy without bumping into everyone, falling over, and stressing out about noise and bright lights. During this presentation, the language used to discuss sensory processing may differ from what is used in your country, as will the treatment modalities. Now, what is sensory processing disorder? Sensory processing disorder, also known as SPD or sensory integration disorder, is a term describing a collection of challenges that occur when the senses fail to respond properly to the outside world. Though the condition has gained recognition in recent years, it is widely debated and is not currently an official DSM diagnosis. The five external senses of vision, hearing, touch, taste, and smell, as well as the internal vestibular, interoceptive, and proprioceptive senses, are critical for interacting with the environment. When the sensory receptors in the nervous system malfunction, as they're theorized to do in sensory processing disorder, common stimuli like lights, noises, and textures may be perceived as too bright, too loud, or too uncomfortable. Sensory processing issues may also manifest as input-related challenges, resulting in sensory-seeking behaviors, compensating for low levels of tactile or proprioceptive input. Now, here are some symptoms and some other signs that you might see in your child. They might be easily overwhelmed by people and places. They may also seek out quiet spots in noisy, crowded environments. They might be easily startled by sudden noises. They might be bothered by bright light. They might refuse specifically to wear itchy or otherwise uncomfortable clothing. They might avoid touching people or hugging them. They might have a strong reaction to the texture or smell of certain foods. They might refuse to try new foods and have a very limited diet of preferred foods, or they might get upset about small things in routine or environment and avoid trying new things. And here are some other signs you might see in your child at different ages. They might constantly touch objects, they might play roughly and take physical risks, they might have a high tolerance for pain, they might often squirm and fidget, they might constantly be on the move, or invade other people's personal space, they might often get distracted or feel anxious, or they might be clumsy and uncoordinated. Now, there's a thing here, what not to do, and I think this is a story personally in from someone from the site that we were on, and it said, I once had a 7-year-old boy in my school named Joe who had sensory processing issues. Joe reacted strongly when anyone touched him, especially if he wasn't expecting it. He had trouble in gym class and in hallways at school where other kids might bump into him. He would yell and sit on the floor holding his legs to his chest to avoid situations where he might be touched. At home he didn't want to be hugged or kissed. Family events were a nightmare. Both the school and Joe's mother made accommodations for his tactile sensitivity, but Joe's father wasn't on board, and he came to talk to me since I was an administrator at the school. He told me he thought we were coddling the boy. He wanted his son to just toughen up, so that other kids wouldn't think he was strange. Over the years I've had a lot of conversations with parents when things aren't going well. One of the hardest is when a parent asks how to get a child to toughen up. I know what parents mean when they say this. There come times when you look at how a child is behaving over something that seems so simple, and you just want to tell him that he has to get over it and move on. But as I explained to Joe's father, when a child has sensory processing issues, he's not going to toughen up in the way we might expect from a child who doesn't face those challenges. The flaw in this approach is that a lack of toughness has nothing to do with sensory processing. Here's how I explained this to Joe's dad. People take in information through their senses by seeing, hearing, smelling, and so on. The brain has to process and interpret this information and turn it into something useful to act on. But this process of making meaning from your senses can go wrong. Think about how your hands can get so cold that you can't tell if they are freezing or burning. Or that dress that was all over the internet, the one people couldn't tell if it was blue or white. For kids like Joe, sensory processing doesn't go smoothly in many routine situations. It's not that these kids aren't tough. Their brains simply work differently from the brains of people who don't have these issues. And no amount of telling a child to toughen up is going to change that. Moreover, telling a child with sensory processing issues to toughen up can actually do some real harm. If your child starts to believe he isn't tough enough, he won't develop the self-awareness he needs to understand his sensory issues. He won't be able to explain to adults or other kids why he struggles and what he needs to succeed. Over time, his self-confidence and self-esteem will crumble. Sadly, this domino effect can cause a lot more problems for your child in the long run than the sensory processing issues will. Thankfully, after a few conversations, Joe's dad began to come around. He truly wanted to help his son. He just didn't know how. So I shared with him a strategy to help Joe. Here's what I told him. The next time you want to tell your child to toughen up, try saying instead, I know this is uncomfortable for you. What can we do to make you more comfortable so we can all get going? You'll have to have this same conversation many times, but each time you'll gain a new insight into what might help right now and in the future. Keep track of what your child suggests could help in the moment. Then speak with him about those ideas later when he isn't experiencing a crisis. That way you'll be calmer and more able to really think about the ideas, and your child will develop strategies for the next time an issue occurs. Joe's sensory processing issues didn't go away, and they still flared up sometimes, but his relationship with his father got better. Joe's dad was less frustrated and he was able to help Joe calm down. Joe's reactions also became less intense, so their family could function more easily. I'm not sure if his dad ever felt that Joe toughened up, but it didn't matter, since Joe was happier and more successful because of his dad's understanding and support. So that really helped. You can hear about, it says here, read about 5 situations that can be hard for kids with sensory processing issues, but obviously I think they're here. Take a look at a day in the life of a child with sensory processing issues and explore strategies you can try at home, including different ways to help with noise sensitivity / noise seeking, taste sensitivity / taste / oral seeking, tactile sensitivity / touch seeking, or visual sensitivity / visual seeking. Plus, there is actually a lot of hidden senses, which is movement and sensitivity / movement seeking. Movement sensitivity / movement seeking, proprioceptive sensitivity or seeking, or challenges with interoception, which is highly important for the Tourette's community. Now, from what I've just said there, some things I believe can help, but there has been a study completed but not yet published by Dr. Charlotte Ray. Looking at interoception and Tourette's, she has found some very interesting initial results which indicate that people with Tourette's feel interoceptive feedback more acutely, but the feedback tends to be faulty. So for example, when you feel anxious, you can really feel your heart pounding, even when you're only a little anxious, as opposed to extremely anxious. This, in turn, can make your anxiety a lot worse. So going on to treatment. Since it says, as we looked up, it says, since sensory mismatches can lead to difficulties at school or work, particularly for children, addressing such challenges may help individuals cope more successfully with day-to-day life. Sensory processing challenges are usually treated with occupational therapy or at-home programs known as sensory diets. Though parents and adults can create sensory diets on their own, working with an occupational therapist may result in a more targeted treatment plan. A child who can't discern tactile sensations, for instance, would likely require a different intervention than a child who finds bright lights to be overstimulating. But sensory diets are used in other parts of the world, but some parts of the US and definitely in Scotland, we do not talk about sensory diets. In Scotland, we talk about embedding sensory strategies in everyday life that helps people to cope so that you're not reactive to sensory challenges and trying to manage the challenging behaviour that comes with it, rather proactive minimizing the effects sensory seeking / sensitivities have on the person either as a whole or as a single person themselves. Sorry, I get what is the best treatment for sensory processing disorder? Severe sensory processing issues are usually treated with a combination of occupational therapy and a sensory diet, which typically consists of, as I say, at-home activities that supplement occupational therapies. That supplement OT, yeah. Self-help strategies such as wearing noise-cancelling headphones when exposed to loud noises. It says it can provide immediate help to those with sensory challenges. But this is where we come to another bit. There is strong evidence against using sound-cancelling headphones, guys, and pediatric audiology will absolutely not issue advice to use them. If that level of auditory sensitivity is present, then they need to be assessed for hyperacusis and have remedial sound therapy to recalibrate their hearing via audiology, as well as cognitive behavioral therapy to manage the anxiety. Sound cancelling headphones exacerbate the sensitivity and increase the anxiety. Many people ask, what is a sensory diet? Now, sensory diets are treatment plans for sensory issues, usually designed by an OT. A sensory diet consists of different activities that attempt to address an individual's unique sensory needs, either with individualized calming methods or by gradually increasing levels of exposure to uncomfortable sensory sensations. How does occupational therapy help with sensory issues? Occupational therapists help children develop or strengthen their sensory regulation skills. They can also help children devise a plan for what they will do if they feel overwhelmed by sensory input or are otherwise placed in a challenging situation at school, at home, or elsewhere. Can you grow out of sensory processing disorder? Children tend to struggle more noticeably with sensory issues than adults do. And many children with sensory processing disorder do find that their symptoms lessen or even disappear over time. But sensory issues can continue to exist into adulthood, though often to a lesser degree, especially for those with comorbid autism. I would also say no, that we don't tend to actually fully grow out or grow out at all of SPD, but as we get older we develop better coping strategies and can make life choices to suit our preference and difference. What we find clinically is that our sensory processing is not a constant state. Our preference and difference can and will change, and as adults we develop much more subtle ways of managing our preference and difference so it doesn't stand out as much as it does in children. We can also make choices as adults. For example, if you have movement sensitivity, you might choose a job that is seated at a desk and requires very little movement. Or if you have movement seeking preferences, you might choose a job that requires lots of movements, like a fitness instructor or a male person. So you can manage your sensory challenges. You can manage your sensory challenges in a way that children cannot, as they are expected to fit into a school environment. Many people ask what actually causes sensory processing difficulties. It says here that sensory processing disorder is thought to have a genetic basis, although there is no specific reason for someone to have sensory processing disorder. It has also been theorized to be related to prenatal alcohol or drug exposure, early childhood trauma or neglect, or a lack of stimulation early in the development. I don't think that has actually been fully confirmed, and I don't think that does. There are some theories about what causes sensory processing difficulties, but there are many children for whom this does not apply. Are sensory processing disorders and sensory processing sensitivity the same? Absolutely not. Alright? Sensory processing sensitivity is a personality trait that describes how sensitive someone is to physical sensation or emotional input. Those high in the trait are known as highly sensitive people, or HSPs. Sensory processing disorder, on the other hand, describes a sensory dysfunction in which the senses cannot appropriately process environmental input. So, is sensory processing disorder a real disorder? Now, most researchers agree that serious sensory challenges exist, but whether they should be classified as a disorder has actually been contested. Sensory processing disorder is not in the ICD-11 or the DSM. Rather, sensory issues are included as a possible symptom of autism. Regardless of formal diagnosis, however, there is treatment available for severe sensory issues. Comorbid conditions can be autistic spectrum disorder, tic disorder, ADHD, learning disabilities, anxiety, DCD, which is developmental coordination disorder, Fragile X, fetal alcohol spectrum disorder, or eating disorders. Sensory issues are only officially recognised in the DSM-5 as a possible symptom of autism, and many children and adults who have sensory integration challenges do also have autism or ADHD, which is attention deficit hyperactivity disorder, another condition with ties to sensory challenges. However, many parents and adults argue that SPD can exist as a stand-alone condition and continue to advocate for SPD to be recognised by major psychological organisations as a distinct entity. Are sensory issues a symptom of ADHD? Although over or under sensitivity to physical sensations are not listed as possible symptoms of ADHD in the DSM-5, many children and adults do report that they struggle with sensory overload or other related challenges. Just how sensory issues relate to ADHD, just how the sensory issues relate to ADHD, however, is still not fully understood. Do all children with autism have sensory challenges? Not all do, no. But it may be more common than not. Some studies suggest that up to 3/4 of children with autism struggle significantly with sensory processing challenges. So, my autistic child is very sensitive to light, noise, etc. What should I do? Parents, it says, should minimize exposure to upsetting stimuli when possible, as well as help the child prepare for situations in which they are unavoidable. Occupational therapy should also be explored. But may I add, you must be careful when reducing exposure to upsetting sensory experiences for your child, as this can actually make unavoidable situations significantly worse. You need to look and understand the child's behaviour, what it's telling you, as this will give you insight into why it's difficult for the child. You can then use that information about how the sensory systems are reacting, and you can prepare the child's relevant sensory systems so that they can cope. This is very specialist work and should be supported by an occupational therapist. I want to say thank you everyone for joining. Thanks for listening, and I hope this has made a lot of sense, and I hope it's helped you lots. Thank you.